Philippines, officially the Republic of the Philippines, is an archipelago country in Southeast Asia and the Western Pacific Ocean. It consists of 7,641 islands, has a population of 113 million people. The population density in the Philippines in 2022 was around 385.20 people per square kilometer. The urban population in the Philippines is around 47.89%, with 52% being rural. The Philippines is home to a warm, kind, and largely English-speaking population. The Philippines is most known for its thousands of islands and white sand beaches, such as Boracay, Palawan, and Cebu. The most recognized issues in the Philippines are poverty, a lack of education, drugs, substance abuse, or crime and unemployment.
One of the main biological hazards in the Philippines is dengue. This is a virus transmitted to humans by the bite of an infected mosquito. It's not contagious from person to person. There are almost 850,000 symptomatic cases annually, with half of them needing hospitalization. Most people who get dengue are asymptomatic, meaning they don't experience any symptoms. The risk level for this hazard is medium to high, as the Philippines is a tropical region. You can get exposed to this virus through the bite of an infected female mosquito. On the effect on human health, most of the people who get infected either show no symptoms or have mild symptoms. These include high fever, severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, and rashes. These symptoms may show 4 to 10 days after infection and last from 2 to 7 days. Those who get infected a second time are more prone to severe symptoms, including severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood and vomit or stool, being very thirsty, having pale and cold skin, and feeling weak. It's rare that the virus ends up being severe or ending in death. However, you may feel very tired for several weeks after recovery. While there's no specific medicine used to treat the virus, pain medicine is used for ease of symptoms. In order to promote, the Philippine government established the National Dengue Prevention and Control Program in 1993, consisting of case and vector surveillance, case diagnosis and management, integrated vector management, outbreak response, health promotion and advocacy, and research. The Department of Health has also created the 4 o'clock habit for its citizens, where water containers are emptied at 4 o'clock every day since it attracts mosquitoes. For protection and prevention, you can lower the risk of getting infected by wearing clothes that cover most of the body, using window screens, sleeping with a mosquito net surrounding you, using mosquito repellents, and staying in well-lit environments. You can also get all 3 doses of the vaccine. For a current event, monkeypox is affecting the citizens of the Philippines, as it can easily spread from person to person. The World Health Organization declared a multi-country outbreak on July 23, 2022, and said that it was a public health emergency of international concern. This disease is spreading, and the Philippines should be prepared to deliver an informational campaign about it to inform citizens, including an official website with more info on the disease. Physical hazards in the Philippines involve multiple natural disasters. The Philippines is prone to natural disasters as it sits on the Pacific Ring of Fire. It was given this name because there's lots of geological activity in these areas. This causes them to experience earthquakes, typhoons, flooding, volcanic eruptions, and landslides. On average, the country gets about 20 typhoons, 200 felt earthquakes yearly, and they have over 20 active volcanoes. The risk level for this hazard is high because of the frequency of these disasters and the damage that can be done. For the mode of exposure, location affects how exposed one may be to the disaster. For example, those who are lower in elevation may be more affected by floods, landslides, and typhoons. On the effect on human health, those who survive natural disasters are affected physically, psychologically, and socially. Citizens' health is a priority, as the psychological effects sometimes outlast the physical effects. This can be trauma, anxiety, stress, grief, and/or panic as a result. Many also lose their homes, jobs, and loved ones. For protection, the Philippine and Australian government launched the SHIELD program to mitigate natural disasters. SHIELD stands for Strengthening Institutions and Empowering Localities Against Disasters and Climate Change Program. This program aims to work with local governments in order to build resilience against natural disasters and climate change. In order to promote the awareness of these hazards, the Philippine government, international non-government organizations, and local non-government organizations are all trying to address the impact of disasters and climate change at various levels. There's no way to prevent these disasters, so the most that can be done is to know how to protect from future disasters. The Philippines is implementing disaster risk reduction management and climate change adaptation. For a current event, an earthquake with a magnitude of 5.9 hit Lubang Occidental, Mindoro on December 5, 2023 at 4:23 p.m. in Philippine time. This was reported by the Philippine Institute of Volcanology and Seismology. No damage is expected, however, there will be aftershocks, and the Philippine capital Manila had evacuated buildings such as schools, offices, and residences.
Being an archipelago consisting of 7,641 islands, cultural influence in the Philippines is important to recognize, given the existence of 175 ethno-linguistic groups, each with their own unique cultural identity, health beliefs, and practices. Unsafe working conditions managed to persist in the whole country. More than two-thirds of the country's nearly 40 million workers suffered from labor law violations. The risk level is medium. Logistic regression found strong links between work-related factors and occupational health issues. Notable associations include hearing loss with tensure and gender, headache, dizziness with adequate ventilation, backache with extended work hours. Protection: you have to report hazards to local authorities and adhere to procedures and regulations. You must wear proper protective gear and seek support from higher ranks or authorities. In order to prevent unstable working conditions, DOLE established mandatory occupational health safety standards that protect Filipino employees from injury, sickness, and other health hazards on the job. It gives employees the right to know of their workplace hazards and refuse work and report accidents and wear protective gear. For the current event, no mother wants to leave their child alone, but in the Philippines, it can feel like there's no other choice. Unable to earn money at home, an estimated 2.2 million Filipinos worked overseas last year. According to the Philippine Stats Authority, the majority were women, many hoping to give their child a better future. They work as nurses, hospitality staff, nannies, and cleaners. Last year, they sent 33.5 billion back to the Philippines in personal remittances, a high record, according to the country's central bank.
A specific hazard that we focus on in the Philippines is a chemical hazard, and its mode of exposure is inhalation and absorption through the skin and eyes. In the Philippines, multiple studies have found long chains of PFAS that are considerably higher in women from parts of the country that hold their industrial powerhouses. Women workers that produce smartphones, laptops, and electronics in the Philippines are exposed to a wide range of hazardous chemicals at work, which immensely affects their health. Through multiple accounts, women have complained of chest pains that are attributed to fumes inhaled in poorly ventilated spaces without proper protective equipment. This is due to high levels of forever chemicals. Many of these factors led to miscarriages, abnormal breathing, respiratory issues, cancer, and even death. The factories have stated that they followed relevant Filipino legislation and global industry standards. However, their due diligence processes to ensure safe and healthy working conditions did not take into account the high-risk location. An investigative process to assess and address risks to workers in their supply chain and ensure measures are in place to protect them from chemical exposure. These efforts should employ a gender lens, examining the impacts on women and men separately, and applying solutions tailored to those different impacts. The violent climate for labor rights and freedom of expression in the Philippines makes it next to impossible for workers to claim their rights, and very few can turn to trade unions for support. To promote, the Philippines moved to address chemical safety through the formulation of the National Chemical Safety Management Program, which has gathered support from different government and non-government groups, including Healthcare Without Harm Asia Pacific. In the successful implementation of a comprehensive national program that will effectively tackle the gaps in chemical management in the Philippines, the TWG affirmed the importance of consultations with stakeholders and the collaborative effort of the different government agencies, legislators, civil societies, and a chemical industry. To prevent, taking cue into these real and pressing threats of worldwide proportions, life, and the environment, the United Nations General Assembly called for a global meeting coined as the Earth Summit to come up with strategies to halt and reverse the effects of environmental degradation through chemical hazards in the context of increased national and international efforts to promote sustainable and environmentally sound developments in all countries. As of right now, dozens of people have fallen sick in coastal villages in the Philippines after a major oil spill from a sunken tanker. The empty Princess Empress was carrying 800,000 liters of industrial fuel oil when it sank off the coast of the Oriental Mindoro province last week.